All right, so my name is Sandesh. I'm a part of this hosted team. So what our campaign is centered around is we want to raise awareness for substance abuse. Today, I guess we're interviewing you, a neurologist, to help supplement our campaign.
Well, I'm a neurologist. I work out of Round Rock, Texas. My training is in general neurology, and then I did a fellowship in movement disorders. So the majority of my time is spent treating patients with Parkinson's and other movement disorders like tremors. I do clinical work, and then I also work as a clinical researcher, and I do a lot of clinical trials as well.
Okay, so overall, thank you so much for joining us today, Dr. Peckham. We really appreciate your time. This interview is part of our awareness campaign focused on substance use disorders, including risk factors, protective factors, and brain health. So for our first real question, how does neurology connect to substance use disorders, and why is understanding the brain important when discussing addiction?
Yeah, so I think a common misconception about addiction is that people have a choice, or they want to be an addict, or it's something that they have that's in their control. But, it's really a brain disease. I think our brains function using different neurotransmitters, and there's a lot of reward that the brain gets when you're addicted to a substance, whether it's a drugs or alcohol. And there's certainly a lot of risk factors that set people up for addiction, and we can talk about those on some of the other questions.
Okay, great. My name is Joaquin, and I have another question for you. I was going to ask, if from a neurological standpoint, how do substances affect the brain's reward system?
When you use drugs or take alcohol, it releases a chemical called dopamine, which makes you feel good. There are other neurotransmitters depending on the type of drug used. But that sets in place a reward system, and when you feel good, you want to do it more. And in addition to that, it disrupts your prefrontal cortex of the brain. So you kind of lose the ability to put the brakes and understand that it is an addictive behavior, and be able to stop wanting the substance. So it starts to become somewhat out of your control.
And I have another question. Which parts of the brain are most affected by long-term substance abuse?
That's a great segue into that. So the prefrontal cortex is really the area we think of, again, as the brake of the brain. We all have urges or thoughts or things that you may get upset and want to yell, but you don't, because you think through the consequence of it. And your prefrontal cortex is really important in teenagers, especially because you don't fully myelinate until around age 25 to 27. And so you really don't have the ability to regulate emotion and realizing consequences as much. And so it's even more of an issue with teenagers than as you get older.
So I was going to ask next, how does early substance abuse exposure change brain development over time?
Yeah, so you get into this cycle where you have this risk and then a reward and a risk and then a reward, and your brain is not even fully developed at that time to be able to compensate around it. So it's even harder when you've got a brain that's not fully matured.
My name is Jaden, and I was wondering, are some people biologically or neurologically more at risk for substance use disorders?
Definitely so. So there's kind of a few factors here. I mean, there are definitely roles as far as genetics. There are genes associated with addiction. There are also genes associated with other mental health conditions such as anxiety, depression, ADHD. And all of those mental health conditions set people up as well. If you're anxious or stressed or worried, depressed, oftentimes people reach out to substances to feel better and to get that high in whatever way, or even to relax if you're anxious. And so genes really play a very big role in it.
I also had another question.
Sure.
How does stress, trauma, or mental health conditions increase addiction risk at the brain level?
Yeah, so it's a really good question. I mean, I think stress, we all have stress with different things. When you're a teenager, it may be the stress of school, it may be being on a sports team, it may be competing in a club, such as the one that you all are in. And so we all have different stressors. And when you, again, seek out some substance that gives you a reward, then it gets harder and harder to break that down. So I think if you're stressed, people tend to turn turn towards that more. And then when you are addicted to something, and it's harder to get off of it, and you can have withdrawal from trying to go off the substance, whether it's alcohol or drugs, which then increases anxiety and irritability. And so then you want to do the drug more because you want to suppress those bad feelings again.
All right, great. So I was also wondering, how do sleep, exercise, and supportive relationships protect brain health throughout time?
Yeah, well, and kind of in the same vein as what we talked about. I mean, I think sleep, exercise, supportive relationships, all those things decrease your stress level. So, sleep is the time for your brain to kind of repair itself, adjust, get rid of waste products. You wake up in the morning and you feel much better. Exercise helps to increase endorphins, so you get good feel-good hormones or neurotransmitters from exercising, where you may not need to have a substance. And then I think supportive relationships help reduce stress. Having somebody to talk to is very important. Having a family that's supportive.
So that sort of goes along the lines of like really having like a village to help you get through whatever disorder you're going through, I would say.
Definitely so. Yeah, absolutely. I think having that, the support when you're a teenager, and there's many, many ways to get support, but your family, your community, sports teams, those all play a role. Academic teams, getting support in any way, and I think recognizing it is a number one piece. I think that I work with a lot of older patients, so most of my patients are 70s and 80s as far as how old they are. With you all, I think there's much more awareness of mental health than there is in the geriatric community. I think a long time ago it was very much shunned and thought to be something to be embarrassed about, and I think now we realize how important mental health is, and mental health and addiction are just so closely tied together.
So like going back to that point, as you're saying, like mental health and like the connection between those two, like how do they like really correlate?
Yeah, so a few things. I mean, when you think about somebody who is, when I have somebody in clinic, for example, who has an alcohol use disorder, oftentimes they're either anxious or depressed. So they have some sort of unsettling feeling that they're trying to feel better. If you're anxious and stressed, alcohol is kind of a depressant on the nervous system. It makes you feel relaxed and calm. So that's why, people do it. You kind of look and say, oh, well, gosh, they're just an alcoholic and how could they do that? But it really goes much deeper. I mean, you really have to look at not that somebody is using a drug or alcohol, but why? What's the basis for it? It may be that they were exposed to it when they were really young in their teens and they became addicted early and it was really hard to get off of it. Or it may be that they suffered emotional abuse, trauma. Maybe they're genetically predisposed to being more anxious or depressed. And so I think when you look at substance use, you really have to look deeper.
What are like some preventative measures that can be taken to work around this issue of like substance abuse as a whole, not just for like alcoholism, but like as a broad,
as a whole? Yeah. So, I mean, I think first is just education and awareness. And again, that's what I was speaking to with, I think your generation is much more aware of mental health. I think it's much more aware of substance abuse. I don't think it was really talked about when you look at older generations. So I think trying to get help early on for underlying psychiatric issues, anxiety, depression, stress reduction, whether it's medication, therapy, alternative methods, meditation, biofeedback, hypnosis. I think being involved in something is really important, whether it's, sports, academics, music, whatever you seek out, because I think that gives you positive feedback in different ways. It also is a good use of your time. I think sometimes alcohol and drug use happen because people have a lot of time and they maybe have the means or the money to reach it, and so sometimes that's what happens. But it's complicated. It's not a simple answer for any of this.
Okay, in your perspective or in your experience, how like prevalent is it in like the different communities and the different societies that we have?
Yeah, it's a good question. I mean, I think when you have a society or community with less parental and social support, then it's a bigger factor because you don't have maybe a positive role model. Maybe again, there's been abuse, neglect, trauma. I think that sets people up, in a situation environmentally, which makes things harder. And frankly, access to mental health is not as easy as it is for physically if you're sick. If you have a cold or the flu, mental health services oftentimes are not paid for by insurance. A lot of psychiatrists, and I'm a neurologist, so everything I do is on insurance, but a lot of psychiatrists and psychologists that I found, they end up not taking insurance because it's really not recognized as a society as big of a problem as it is, and so we don't give enough credence to it.
Continuing on this, what is one misconception about addiction that neuroscience helps correct?
Yeah, I think you have to think of it as a brain problem rather than, I think, we tend to categorize mental health in a different area, and it's all your brain. I tell patients that all the time, whether you're anxious or depressed or you have tremors or can't walk or whatever it is, it's all your brain. So it's all there. So I think that you have to think of it as a brain problem rather than something that people can just easily fix or manage or take care of, and that they need support.
Finally, what is a message that you have for young people regarding substances and their effects on their brains?
Yeah. So, I think, again, and this kind of loops back into what we previously talked about, but it's just really important to remember and maybe raise awareness that the brain takes a long, long time to develop. That prefrontal cortex is in an especially vulnerable position because it's not till your mid-20s where you're going to fully myelinate and have full function. And so you're at risk. So that, the awareness and the education on that, I think, is really important. And I think it's really important to recognize early on mental health issues that put people at risk, social issues that put people at risk. So when you're seeing your general pediatrician, because most kids do at least a well check, looking for anxiety, depression, ADD, finding out about how their home life is, what's the social situation, what activities are they in, so you can try to address and mitigate any risk factors that may put somebody at risk for substance abuse.
All right, that concludes our interview for the most part. So thank you so much for your time and insight.
Sure.
And we truly appreciate you speaking with us today.